Good day to our dear partners and fellow graduates from Santiago, Binyan, Manila, Naga, Mandaue, Iloilo, and Iligan. In behalf of our beloved Mayor, Mayor Imelda Aguilar, Vice Mayor April Aguilar, and the OIC of Las Piñas City Health Office, Dr. Juliana Gonzalez, I am proud to present our journey with TCI in the improvement of our adolescent health and development program in our city. The current population of Las Piñas City is 628,652 based from the 2025 data from the Department of Health. From this, adolescents between 10 to 19 is 107,113, which is 17.04% of the city's population. The city of Las Piñas has at least 20 barangays and 30 health centers. These health facilities are all Level 1 accredited for adolescent-friendly health facility. Aside from 30 Level 1 AFHF health centers, there are 3 teen centers in the city, 2 teen hubs, which is a school-based teen center, 1 social hygiene clinic, and 1 LGU birthing clinic. At present, there is no LGU-owned hospital in the city of Las Piñas. The data for modern contraceptive prevalence rate and adolescent birth rate prior to the presence of the challenge initiative include the following. There is a fluctuating trend of MCPR as opposed to the national target. With respect to adolescent birth rate, some fluctuating trend is observed. There was increase in ABR from 2021 to 2022. It is noticed that there are more reported pregnancies than the deliveries and live births. The reason might be that they transferred to a different place to avoid any issues after they are diagnosed with adolescent pregnancy. Sometimes, they tend to hide the pregnancy and opted to deliver in the province. Our city was included in the third batch of the Challenge Initiative and immediately formed the city leadership team. We had our 3-day program design workshop last July 10, 11, and 12, 2023, and we were able to extract the problems faced with the adolescent program in our city. Namely, different adolescent stakeholders have services for the youth that sometimes are just duplication from another partner. Services are fragmented or disjointed. No policy harmonizing the different efforts being exerted by various agencies that are prioritizing adolescent welfare, and no identified leader or proponent. The project objectives include the following. To create a protocol that can unify all adolescent serving institutions into a functional network by 2024. To create a functional referral algorithm unifying the branches of health, social welfare, education, and security by 2023. To capacitate the ISDN members to develop policies and monitor implementation of the network. To capacitate frontline workers in the screening and referring adolescent concerns to the appropriate channels. The major strategies include identifying the stakeholders and identifying service delivery points, workshops on the establishment of ISDN for adolescents, identify frontliners and point persons for referral network and capacitate providers, development of communications plan, and targeted demand generation and health promotion. In each major strategy, there are activities and steps made easy in identifying stakeholders and mapping of existing adolescent-friendly facility. There was a development of protocols during the establishment of ISDN, as well as ongoing training for frontliner. After launching last December of 2024, we have a plan for community engagement and proceed with monitoring after testing. For the timeline of activities, last December 4, 5, and 6, 2023, a 3-day live-in training workshop on the establishment of information and service delivery network for adolescents and participants were from the different adolescent stakeholders, such as CHO, DepEd, CSWD, PNP, LYDO, PESO, and SK, was given by CPD. Follow-up meetings were then conducted last January 25, 2024 and February 26, 2024, which are the follow-up meetings with the team to finalize the directory and the referral algorithm. There were also a series of case management conferences involving the different stakeholders, which became a venue for us to discuss further and enhance the referral pathways. The first case was presented by the City Health Office. The second case was presented by PNP. Their office was able to present the protocol and the process of dealing with adolescents, both with less and more serious crimes. The third case was presented by the DepEd, and they discussed abuse cases in school and the process on how they deal with the cases. In the beginning, we are pushing for the ISDN of CPD. However, we have now the CADA network of the DOH, which is almost the same. We were called to joint hearing in the City Council last September 17, 2024, to present the ordinance and explain its importance to our program. It was authored by our SK Federation President and the Councilor for Health. The DOH CADA network, or the Key Assistance for Developing Adolescents, is an initiative of the DOH, Department of Health, aimed at improving the well-being of adolescents, particularly in the area of sexual and reproductive health. The CADA network recognizes the vulnerabilities faced by adolescents, such as increased risk of STIs and HIV, early sexual initiation, unwanted pregnancy, abuse, and mental health issues. It aims to provide them with reliable information, guidance, and support from trusted adults in a safe and non-judgmental environment. CADA network was signed into an ordinance on September 23, 2024. On December 6, 2024, the launching of the Information and Service Delivery Network for Adolescents and the CADA network was done. There was also the pledge of commitment signed by the different adolescent stakeholders. After completing the strategies and implementing the interventions, we were able to finally produce the ISDN directory. Here is the cover of the directory and the list of services. The main offices were also listed, as well as the teen centers and all 20 barangays with their contact number of the barangay hall, health center, VAUSI, and the BCPC. Also, the list of the point person was also listed in the directory. This is the final product. I really wanted it to be ring-bind for easy editing and replacement of content if ever there will be changes in the future. The next selected slides that I will show are the referral pathways based on where the adolescents seek consult and the process that they will follow. This one deals with adolescent pregnancy detected in school. This is the algorithm of adolescents who seek consultation in health centers. This one is on adolescents seeking consult in SK offices. This algorithm is a referral pathway for child abuse. In the realization of our project, there are lessons learned. First, we have a good relationship and communication with adolescent stakeholders and partners can make our goal easier to achieve. Dedicated adolescent stakeholders are important and crucial in the realization of this project. There will still be continuous trainings for adolescents and will focus mainly on life skills to make them more resilient in times of stress and problems. Coordinating with the Health Promotion Unit to help us in the monitoring and evaluation of our trainings and workshops. There will also be a regular meeting of the city leadership team to assess the different activities of each office and can also be a venue to discuss plans involving the young population and an avenue for the improvement of the services offered for our adolescents. For the family planning program of Las Piñas in terms of MCPR, the increase in the numbers can be attributed to the additional health workforce which were trained in PSI insertion. At least 18 HCP were trained, or the healthcare providers. Additionally, the implementation of enhanced usapan enabled the city to pull the figures up to an increasing trend. The city also hired FP implementers to provide additional support through mapping of potential users. I would like to acknowledge the city leadership team and its members who have been truly instrumental in the success of our program. I recognize your contributions and your hard work. Thank you very much sa inyong lahat. As a conclusion, we still have a long way to go for our adolescent health and development program, but we are very grateful with TCI to give us the opportunity and much needed push to improve our services for our adolescents. We are very optimistic that what we have started will be beneficial to our young population in the future. Thank you very much, and we hope to have more future partnerships with you. Good day, and God bless us all.